reasons you shouldn't take statin drugs for your high cholesterol. Hi, welcome back to the channel. Today I am going to talk about 5 reasons why you shouldn't use a cholesterol lowering medication for your diagnosis of high cholesterol. I know this is a controversial one because a lot of associations here in the US wants doctors to put you on statin drugs. And I understand the importance of lowering cholesterol, especially for patients that have the risk factors such as diabetes, those that have the risk factors of heart disease, right? And high blood pressure or history of stroke. I understand why it's important to lower the cholesterol in these patients. But I want to tell you that there are patients that should not go on statin drugs because they have these 5 reasons, okay? The first one is if your total cholesterol is high because of your total HDL number. Okay, what do I mean by this? So when you get your cholesterol levels checked or your lipoproteins or your lipids panel, we see a few things. One is what we call the HDL, which is also termed your good cholesterol. The second one we look at is your LDL, which is called the bad cholesterol. And then we also look at a third one called your triglycerides, okay? So it's very important for you to know the differences within this cholesterol types. And then we look at the total number of your cholesterol and we call that the cholesterol level, okay? So when we look at the total cholesterol, a lot of times what's being factored in there includes the good cholesterol and the bad cholesterol. So you might get a number that says your total cholesterol is 250. And out of that 250, 70 of it is from your good cholesterol and the rest is your bad cholesterol. Well, if we look at the breakdown of cholesterol most of the time, yes, most patients have really high bad cholesterol. And for that reason, they need some intervention. Does it have to be a statin? That's a topic for another video, but they need some type of intervention. Now, the intervention we pick varies from doctor to doctor, but generally the algorithm tells us that we should put you on a statin drug. Statin drugs were invented to help reduce inflammation and also cholesterol level by blocking the enzyme that converts cholesterol, right? So what we know is that certain patients do not need these medicines, and those are patients that their actual good cholesterol level is what's causing the elevation of their total cholesterol. So good cholesterol, the way I think about it, and I explain it to my patient, is think of your artery like a street where you live, okay? On that street, you're gonna have garbage trucks that come every now and then to pick up the crud, right? They pick up the garbage, they dump it to go take it to the dumpster. And then you're also gonna have people that litter your street, right? So those are considered your bad cholesterol, the people that come in and litter your street. And the garbage trucks or the good cholesterol is what comes on and picks all those garbage and takes it away. Okay, so if you think of it that way, would you like to have a lot of garbage trucks coming through your street so they can pick up the crud? Of course, right? So that's why we encourage patients to improve or increase their HDL. So when your HDL is higher, it's a good thing. It reduces your risk actually. So we want high good cholesterol. The bad cholesterol, on the other hand, the LDL, is the one that we want to lower because that's the one that's littering your street or your arteries or your blood vessels. So we want to lower the LDL but we like to keep the HDL high. So I don't put my patients that have a good amount of LDL, but a really high HDL on statin drugs, even if the total cholesterol stays is higher than 200. Okay, hope that makes sense. All right, so if your good cholesterol is really high, that's the number one reason I won't put you on a statin drug. Okay, how do we improve your good cholesterol? It's through diet, taking niacin, which is a B vitamin, and exercise. Simple, you can do that. You can exercise, you can take niacin to help improve that. And so we can get your good cholesterol better so you don't have to go on the statin drug. Next thing is patients that have thyroid disease. So I've mentioned on this channel when we were discussing the series on thyroid that some patients have thyroid disease that's actually the cause of their elevated cholesterol level. So for me, if I'm treating a patient with abnormal thyroid levels and we haven't gotten that under control yet, I don't put them on a statin drug because I want to get their cholesterol better by improving their thyroid disease. Once I improve the thyroid function and it's now working well, if there's any leftover cholesterol problem, then we'll deal with it at that time. So I don't just immediately hand them a statin drug to just lower that when I know we're still addressing the thyroid disease. Okay, that's number two. Number three, patients that their cholesterol is high due to terrible diet. Okay, if your diet is terrible, we need to work on your diet. Okay, we're not going to band-aid you with a drug. No, we need to work on your diet. You're eating fried chicken, you're eating, things, everything fried, French fries, fried this, fried that, oil on everything, and you're not exercising. No, we need to fix that first. Your lifestyle is first. We've got to fix that because putting you on a drug still does not fix the inflammation and all the other problems that you're causing with that poor diet choice. So my first choice is let's fix your diet, let's work on that, let's lose some weight so we can lower that cholesterol naturally and I don't have to put you on a medication that's going to cause other side effects and we then have to put you on other meds to deal with those side effects. Okay, so the third one is diet. We've got to fix the diet. Okay, another reason why I would not put my patient on a statin drug is if they have already having muscle aches and pains. Okay, so I have patients that have chronic pain from one reason or the other, or they have diagnosis of fibromyalgia, or they have, just other causes of, connective tissue disease where they have a lot of pain in their muscle and always hurting. Okay, so while we're addressing that, the last thing I want to do is give them a medication where the number one side effect or one of the most common side effect is muscle aches and pain, right? So because the same enzyme that this statin drug is blocking is what causes that achiness in the muscles. So I don't want to exacerbate the problem the patient already has, so we're not going to use a statin in that patient. We have to find other choices. In fact, we're going to start with their lifestyle. We're going to start with helping them lose weight. We're going to start with some nutrients, things like fish oil, CoQ10, taking a lot of fiber, right? Eating the right foods. We're going to use those. We're going to try garlic. We're going to try those type of options to try to get that cholesterol down without giving them something else that's going to cause more aches and pains. Okay, now number 5 reason why I wouldn't put my patient on a statin drug is if they're going through a lot of stress, especially stress that's self-induced. Well, patient is taking on too much, right? You only have 24 hours in a day. You gotta give yourself some time to sleep. You're not sleeping. You're working 3 jobs. You're a caretaker, and you're the owner of the business, and you're the janitor in the business, and you're the accountant of the business, and so on and so forth, right? You're doing all those things that is elevating your cholesterol level due to stress and cortisol imbalance. Then we have to address that. Abandoning you with a statin drug, yes, it might prevent you from having, a cardiovascular event and things like that, but underlying all that is other problems that high cholesterol and that stress is causing, right? So we have to address those. So Those are 5 reasons why I wouldn't put my patient right off the bat on a statin drug. I think that we have to understand what is causing the elevation of the cholesterol, deal with that first, address that, remove that. Then if the patient needs a statin drug after that, we can then consider it. And then there are also other natural things we can do, right? A lot of patients are very successful using, red yeast rice to help lower their cholesterol. I might go to that before I go to the statin drug. Hope that has been helpful. If you like this video, share it with someone that you know maybe is having some aches and pain, and on top of it is still taking a statin drug, so they can talk to their doctor about other options. I'll hope to see you on the next one. Bye.